Hello and welcome to another session of IHW Council's Jal Jeevan Conclave. I'm your host, Anisha Nayar Dhawan. Today is World Water Day, which is observed on March 22nd every year to increase awareness about the importance of water to the whole world and to focus on issues that arise out of the lack of clean drinking water. It has been IHW's Council's mission to talk about awareness about health and how the wash, which is your sanitation, your water, your hygiene, how these issues remain still very important for a developing country like India. Here's a glimpse of what our experts had to say in the Jal Jeevan Conclave that IHW Council organized a year earlier in 2021.
As our billion-plus nation desires to become a healthy, happy, and a prosperous society today, an aspiration that has been ignited by our Prime Minister's vision of making an Atmanirbhar and an Ayushman Bharat, ensuring access to safe, drinkable water to every household is among the most critical building blocks for this.
देश में 70 साल में आजादी के समय से लेकर के और 2019 तक या 2019 के अंत तक कुल मिलाकर के 3 करोड़ 23 लाख घरों तक पीने का पानी पहुंचा था। हमने इस लॉकडाउन के कोविड की स्थिति के होते हुए भी इस 15 महीने के समय में लगभग 4 करोड़ घरों तक पानी पहुंचाने में सफलता प्राप्त की। देश के 52 जिले ऐसे हैं जो 100% जल समृद्ध हो गए, जिनमें जम्मू एंड कश्मीर के 2 जिले भी शामिल हैं। देश के लगभग 80-85 हजार गांव ऐसे हैं जिन गांव में एक भी महिला को घर से बाहर पानी लेने के लिए नहीं जाना पड़ता। लेकिन इस सब के साथ साथ में आने वाले समय में जो चुनौतियां हैं उनको पार करते हुए हम हर घर तक पहुंचा पाए, इसका लक्ष्य हमारा और इसका जो है हमारा संकल्प और अधिक दृढ़ से दृढ़तर होता जाता है। किसी भी ऐसे काम को पूरा करने के लिए सबसे पहली आवश्यकता होती है पॉलिटिकल विल। दूसरी आवश्यकता होती है पब्लिक स्पेंडिंग की, कि देश की सरकार पैसा खर्च करे, राज्य की सरकारें पैसा खर्च करे, उस क्षेत्र में निवेश हो। मुझे अत्यंत प्रसन्नता है कि 3,60,000 करोड़ रुपए का ये जो जल जीवन मिशन का कार्यक्रम है, इसमें देश की सरकार राज्य की सरकारों के साथ में इसे पूरा करने के लिए पूरी ताकत के साथ खड़ी है।
Good water is a good health. Good health is also good life.
In our country, what we need is how to have very affordable toilet and very affordable water supply of high quality, but by using appropriate technology or low-cost technology.
If we have created the problem, we are the solutions to the water crisis, and the time for this to act is now.
Our job is to get everybody work together from all different sectors so that we are able to be very efficient rather than working alone.
हर 5वीं बीमारी पानी से संबंधित है और हमारे देश में जो डिजीज बर्डन है वो दुनिया में जितने भी देश हैं उनके डिजीज बर्डन में काफी आगे पहुंचता है। जल ही जीवन है, जल से ही कल था, जल से ही आज है, और जल होगा तो कल होगा, नहीं तो कुछ नहीं होगा।
In the Jal Jeevan mission, I think this will be a very critical factor for its success. I mean, we can very easily, lay down the engineering design of how we want to supply water from point A to point B. And I think the success will lie if we are able to enable, as I said, our Gram Panchayat, our people on ground who are able to maintain it and sensitize them enough to be part of the system by making them realize the value of water and bringing that, moving it from that commodity approach to a valued resource approach.
I think that any people-centric solution that gives a role of the people to play in the overall water governance and overall water management at the local level, whether villages or urban areas, is something which is non-negotiable if you're looking for a sustainable water supply systems, etc.
As of August 2019, before the Jal Jeevan mission was announced, only 16% of the households, so only 3 crore of the households used to get their water directly from the taps. With the announcement of this Jal Jeevan mission, So from 16% now we have come to 37% in last 1.5 years.
It is estimated that waterborne diseases have an economic burden of approximately $600 million a year in India itself. This is especially true for drought and flood-prone areas, which has affected a third of the nation in the past few years. Not having access to safe and reliable water increases the risk of many waterborne non-communicable diseases. In this session, we will discuss the challenges faced by the government and private healthcare infrastructure providers to manage these diseases, which is impacting the overall health of the vulnerable in affected rural areas as well as urban slums. We will now discuss the impact of clean water, or rather the lack of it, for fighting non-communicable diseases and chronic waterborne diseases and saving lives. Please welcome our esteemed speakers who are experts in their fields who are going to be discussing this critical issue with us. Please welcome Dr. Sarman Singh, former director and CEO of AIIMS Bhopal. We have Mr. V.R. Raman, national convener of the Public Health Resource Network, Mr. Rohit Bansal, advisor, Agra Smart City Limited, and Mr. Tamkor Singh, wastewater and sewage expert, PMC, Faridabad Smart City Limited. A warm welcome to all of you. Thank you so much for taking the time to join us today. Dr. Singh, I want to start with you, and the question is for Dr. Sarman Singh. So, how serious is the issue of waterborne NCDs in our country?
Yeah, thank you, Anisha, and thank you, the ISW, for this opportunity and to put forward the views. I was just seeing the your video clip, which you have prepared very nicely from all the experts and those who are in the power. And I think this is highly commendable that last few years we have achieved some goals to great extent. Still, India remains in need of providing safe drinking water to a larger population, very high population. We know historically, if you see that, I don't know, I am sure that probably most of you, if not all, must have seen the Golconda and Hyderabad. If you see that in old times also, the architects or the engineers of those times, they were very, very particular about the water, harvesting, supplying, and providing the water to each and everybody in their kingdom. In those days used to be. Another example I would give, recently I was in Udaipur, so I was fascinated and I wanted to give you an example here also. Again, if you see the Udaipur and all the lakes, they are connected with each other. So, one lake, is full, then, it goes, the water overflow goes to another and like that. So historically, if you see, the water conservation has been need of the population, and almost all whether they were democratic like we have these days. The earlier we had the kingdom, monarchs, and others. They were also concerned about how to give those days. Obviously, the concept of safe drinking water was not there, but at least water was duty of each and every ruler. Those they ruled their monarchs and countries, and therefore it is very, very important. And now, because the development of the science and technology, and we know that many of the diseases, they are related directly or indirectly with the quality of the water. We all know that there are various diseases which are primarily caused by contaminated water, and contamination can be in various forms. This could be contamination because of industry, it could be because of agriculture, it could be pharmaceutical or waste, or sewage mismanagement, and the contamination of the rivers or underground water can reach from one state to another, one district to another. So providing safe water in one district or one state, I would say it is not sufficient enough, and obviously this whole issue should be seen as a in the global, in the context of India, as when I say global means all states within the country. So that should be seen, because the contaminated water can be taken from through the underground water can be taken by the rivers from one state to another or one district to another. And therefore, it is duty of each and every one of us as a public, as a government, as a official, and policymakers, that we should strive to make drinking water available to each and every one of us. Little bit, I will give you the brief, about the what are the various diseases they can have because of the contaminated water. We can start with the infectious diseases. We know age-old, the giardiasis, amoebiasis, various other parasitic diseases, including the hookworm, which causes anemia, giardiasis, which is a major issue in the children and others. We can have the viral disease, rotavirus, norovirus, and then various bacterial diseases like including typhoid, cholera, and you name any gastroenteritis and MDR bacteria, plasmid containing bacteria. We can also have non-infectious disease, also equally very important. These could be the microplastic, because of microplastic, which is known to cause the cancer, carcinogenic. There could be various hormone disrupting agents in the water, and that can lead to premature puberty and various diseases in the women. Then it could be various drugs which are toxic in quantity. This could be arsenic, could be cadmium, could be uranium, could be high quantity of calcium or phosphorus. So all these things, they can lead to various kinds of diseases, including they can impact our brain, they can impact our GI, of course, then liver, the kidney, and our well-being as a whole. So therefore, it becomes duty that we should first, number two, like as our standard, the SDG of the sixth number, if you see UNDP SDG, number 6, water is always a priority. So it is in top 10. So this is a definitely priority, and therefore we should, to keep our population healthy and high thinking, so brain works fine, the body works fine, and our hormonal, our genitourinary and other systems, they continue to work in normal way. We have to have least contaminated, if not absolutely drinking water. Thank you.
All right. Right. So Dr. Singh has highlighted for us the kind of diseases that could happen to the populace because of the lack of clean drinking water. Mr. Dhawan, my question to you is, over the last couple of years, have we seen an improvement in waterborne NCDs? And why I'm asking this is because during the time of the pandemic, there was a huge emphasis on hand washing. And some of these waterborne diseases are also caused because of lack of hygiene and sanitation. Has there been any improvement? Because in the number of cases reported, because people are washing their hands, maybe if not out of public awareness, but because of fear of the COVID pandemic.
Very important and very pertinent question.
Mr. Singh, Dr. Singh, this question is for Mr. Raman. So please let him answer.
Yeah.
Mr. Raman, you're muted. Would request you to unmute yourself. Yeah.
All right. So I also initially thought that it is for Professor Sarman. So that's why I was on ease. All right. See the importance of hand washing, sanitation, and hygiene when it comes to the impact of the public health impacts of water. It's quite proven and quite discussed. So in the context of this year's World Water Day, if you look at this issue, and to the very theme of the conference, that Jal Jeevan, the pipe water supply related issues. So how the safe water can impact sanitation and hygiene is the pertinent question that we need to look at. So one, it is quite known that the fecal oral contamination can be very effectively prevented by way of ensuring that water is available for cleaning, hand washing, and also for sanitation. But it is equally important that the water that we consume, as how safe is the kind of water that we are. So one example I'll start with, because I'm quite fascinated to see that I always have been a person who believed and worked for large-scale programs by the governments, and I believe that governments only can actually address the problem in scale. So when I was looking at Orissa state, Puri city as an example I'm talking about. So in Puri, the initiative taken by the Ministry of Housing and Urban Development Department in Orissa is drinking directly from tap. This is the European standard that we are trying to bring into India. So Mr. Mathivardhanan, who is the Secretary of Urban and Housing Affairs, so one of the things is that Orissa government has realized that water is the basic right for everyone. So this is something that the Jal Jeevan mission in the national context also has done, that the functional household tap connection is the kind of medium for which, through which the government will assure that all households in India, irrespective of the locations, irrespective of their, ability to pay whatever. So the government is going to ensure by 2024 that all households will have functional household tap connection. So this has an important relevance. So how can we, while water connection is given, how can we address the issues of the most vulnerable people for health issues? So that is one thing that I wanted to highlight. The slum populations living in slums, the urban poor, what kind of hygienic water supply can we assure for them, so that the children, as you asked in your question, specifically of those underprivileged communities, they can access from clean, I will shift slightly to to safe. That is one important issue, because clean quite often goes into visibility, although that is the internationally accepted terminology these days, clean water. But I would still, insist the old terminology of the safe drinking water, because that safety is quite important. How much are we able to look at the safety of the water? So some of the towns that we know are quite notorious or some of the even rural areas, not even, many rural areas are also known for water contamination, whether it is arsenic, whether it is fluoride, whether it is nitrate, whether it is in Punjab, what we hear is uranium. So radioactivity, Professor someone was mentioning about this cadmium, uranium, those kinds of contamination is also happening. So how the infrastructure for frequent water quality testing is introduced is a major question. So I work for the WHO's water safety planning committee. So we in the last year in Sri Lanka, there was a meeting of this committee as part of the International Water Association's conference. So I was there with several experts in the country, in the world from various countries. So one of the issues that was discussed is how the low and middle income countries, specifically like India, can look at water quality infrastructure. Water quality infrastructure from a point of view that testing is frequently done to know that our water is contaminated with these potential contaminants, and which is leading to various types of problems. So I was also looking at one of the journals recently, so wherein the new kind of evidence is suggesting that water quality has connection to adverse birth outcomes, in some cases even to low birth weight. It is also talking that chronic kidney diseases and water quality has some correlation, and radioactivity can definitely go into other kinds of issues as well. What we focus at this point is 14 kind of contaminants in India. So wherein fluorosis and arsenicosis becomes the most important kind of issues that we look at. The urban areas, particularly the geogenic contamination by fluorosis and arsenic, fluoride and arsenic, has gone up now. So our groundwater, also to this year's theme, our groundwater is contaminated with these issues, and nitrate is a anthropogenic, human-made contamination, and other we have also plastic, as mentioned by Professor Sarman Singh. So all these contaminations, how we can set up systems, plans for purification, rather than making people to depend on the private market-driven purification, how the water supply itself can look at the safety, and how our urban local bodies and rural local bodies can ensure that such safe and clean drinking water is reaching to not only the elite, elites who are living in well-to-do colonies, but also to the poor populations living in slums and other settings, also to those homeless. So we need to look at the vulnerabilities of the populations as well, and the rural population, the operations and maintenance of the systems that we set up.
Right.
There are a lot of things that we need to address. Over to you for now. In case there are other questions, I'm happy to.
Dr. Bansal, Mr. Raman has raised an important point about testing. I want to understand from you, he said that we previously had a speaker and the government is very, very confident of meeting its target of piped water to every household by 2024, which is just 2 years away. But is piped water equal to safe water? What is the role of water management, waste management, what Mr. Raman pointed out as testing, to ensure, like in America and in Europe, you can just open the tap and drink water, but in every household in India, at least in the urban centers, you'll see a private filtration system. So what does it mean? Piped water is equal to safe water?
Nice question. And majority, I can say the things worldwide, whatever is happening, that Mr. Raman has discussed these things, and Professor sermons are also discussed regarding this. But being a part of the Smart Cities mission, especially in Northern India, what they are doing and how it is helping, they will discuss the things within 5 minutes. This is very common that WHO also says that 80% diseases are due to waterborne diseases. And for that, not only the level of government of India level, I can say local bodies, especially municipal corporations, are also emphasizing.
Dr. Bansal, I'm sorry to interrupt you here, sir. Your audio is not coming clear to us. Would request you to please, check your audio and perhaps try another microphone so that we can hear you better, sir. Until you do this, I will pose the same question to Mr. Chamkor Singh of Faridabad. Mr. Singh,
now is it audible? Now is it audible to you?
No, Dr. Bansal, the audio is still very scratchy. So I just request you to please try another system, an audio system, and we'll come back to you. And I request you to please mute yourself till then. Dr. Bansal, please mute yourself.
Okay, I'm
right. Right. Mr. Singh, Mr. Chamkor Singh, I wanted to ask the same question to you. While piped water is a welcome change for those in our country who have to, walk for miles to source water, does it equate to safe and clean water to drink?
Yes. You are asking about the piped water, the potable water, the drinking water, or the HTP recycled water?
I'm saying that when the government delivers on its promise of piped water in every household, will that water be safe to drink? Will it mean that we will not have the waterborne diseases?
Actually, in most of the municipalities, they are providing the treated water. They are having, if the source is the surface water, then they have like the water treatment plant, which consists of the clariflocculator, the filtration, the chlorination, and all those things. So in that case, the water is very much safe, and we can easily just on the tap and we can take the water. However, in some of the cases, the government is providing the underground water. So there, first of all, actually the water analysis is very much required. There should not be any like the harmful components such as the manganese and all those things should be there. In that case, some kind of the purification in the houses also is required. As per me.
All right, Dr. Bansal, let me ask you now. Let me try to check if your audio is working. So, Mr. Singh is saying that when water is sourced from surface areas and provided by a tap, it is fairly safe to drink. But when you're using groundwater to supply water via a tap to a household, there are tests that must be carried out and the water must be tested. Now, in our country, reliance on groundwater remains very high, much higher than the global average. Our testing facilities keeping up with the kind of infrastructure required where water will be available in every household via tap.
Good afternoon, everybody. Anisha, my voice is audible to you now?
Yes, sir. This is better. Please go ahead.
First, thanks to Mr. Professor S. Raman, Mr. Raman, and Chamkorji. They have highlighted the things which are very important, and the different departments are favoring and doing the things related to that. But whatever you ask related to that, because I am a part of a smart city, I can say not only government of India, state government, local bodies, municipal corporation, they are emphasizing in both the things. It is through water supply, municipal water supply, or groundwater. But thing is this, that you know that WHO also says that 80% diseases are waterborne disease, and India is a capital of that. But only problem is this, due to the large number of people and especially dominating from suburban areas or villager side, the disease is very common. If we talk like you said, especially for groundwater, in India, more than 600 cities or districts are affected due to filaria, and crimpling is a major problem. And arsenic water is there, irons are more, and salts are more. That is the only reason now government, especially local government, is trying. They are taking the PEN project. Like earlier they were having, if you know that in the smart city project, control and command center was taken. And that really helped a lot in any manner, whether it was management of COVID in all the manner. Similarly, now government has invested, I can say, huge amount. Second major project they are shifting from smart city, it is a water supply project. And one project is run by, this is a mutual coordination between the state, municipal corporation, second is smart city. What they are doing nearby, whatever the rivers are there, they are planning to supply the water, the, I can say, river to particular cities. Like I am giving the best example of northern India. Like 150 kilometers distance from here, the district of UP is there. And they planned, that's why we are back. They were interested, the government was interested that Ganga should be supplied to Agra. And they made a project of 300 crores, and now they are able, they supplied Ganga Jal to Agra, and the project was taken by Smart City Limited. That project was water supply, door-to-door water supply. That was 150 crore project, and that is also completed. Now every door they are supplying Ganga Jal. And due to that, up to maximum limit, I can say, by giving the chlorification, and they are reducing the storage of water, that can cause various diseases. If I'm talking the any part, if you take whether it is abdomen part or it is leg part or it is brain part, every part it is affected. If we are going to abdomen part, like Dr. S. Raman clearly says, whether it is amoebiasis, diarrhea, recently cholera, all our abdominal diseases are predominantly that is due to this is contaminated water. If I am talking to malaria, this is again due to stored water that is percolated by that. And the measurement the government is insisting, or you said that different places in one district they are having a plan of to set up 8 to 10 STP plants. It's already set up in Agra, I can say. And I can say after 4 or 5 kilometers everywhere you will find they are having a STP plant. So that the contaminated water is not going to different places, and purified water is supplied. By that we are seeing so many things. Skin diseases was a very common problem in northern India, specifically in Rajasthan, due to that, especially I will say contaminated water. I was talking to all the parameters, all the system, if I'm talking eye diseases, blood, vision was taking place, blindness was done, hepatitis was done, hepatitis A or E, typhoid fever, cholera, diarrhea, recently polio, meningitis, due to brain again, I will say, everything was due to the contaminated water. But this is not end. The various measures are taken care and they are adopting that. vaccination, through vaccination, they are restricting or taking, that we are preventing, especially I can say polio, we are preventing, malaria we are preventing, and recently could be prevented. But only emphasis is this: whatever we can do the best, because our limitation is of resources also. We cannot say that everything, whatever they are supplying in even toilets also in European countries, that cannot be done in India. If they suppose they are having such kind of large population, they could also not do. But under this limitation also, we are doing the different things, and through STP plants and advise that you can wash your hands.
Thank you so much, Mr. Bansal, for your observations. We're still having a little audio issue, difficulty to understand. I'll ask our technical team to help you out there. Dr. Sarman Singh, Dr. Rohit Bansal has pointed out that along with this entire project of getting piped water to every household, the government is also making a big effort to ensure that there are adequate number of sewage treatment plants as well, so that water reaching the household is clean. Dr. Singh, my question to you is that is our public health infrastructure also gearing up to ensure that outbreaks are now fewer? Once you get a couple of cases in a hospital, does the hospital raise the issue with the local authorities? See, we have these issues coming up, get water tested, monitor the people, monitor the populations to see, is this spreading everywhere? Do we have this setup also ready so that once disease starts happening, it is nipped in the bud and we are able to arrest its spread?
Yeah, there is a system, public health laboratories, they are governed by hospitals, of course, mostly by the government hospitals. But yes, this is also a fact, because you have raised this question, which is very pertinent. But we must not forget that about the data says that about 30% of the healthcare setup, also they don't have sufficient water, like for, hand hygiene, to clean their hand after procedures or after, say for example, some technicians, they are doing stool examination. Example I am giving. There can be numerous examples. He is doing a stool examination and he, there is some spill or something. So he soils his fingers or something. And if he is not having sufficient quality and quantity of the water, obviously he can, spread the infection to various other people, which is obviously most of these laboratories or the hospitals, their people are already infected. And very rightly you said that, this infection can spread to not only to their family members, but also to the community. But yes, the question which you have raised that, whether the hospitals, they inform, there is a system, hospitals then themselves, there is a what we call, hospital acquired infections or outbreaks. So if there are outbreaks or hospital acquired infections, we do take care. Mostly bigger hospitals, they have the system in place, and they sometimes most of these diseases or outbreaks, they are reportable diseases or reportable outbreaks. But of course, this pertains to only the infectious outbreaks, but hardly any healthcare setup, even, forget about few institutes, bigger institutes, but like non-infectious, the toxic and the minerals and this kind of, these things, they are hardly done in hospital settings. Usually this kind of surveys or the remedial solutions are given by doing the epidemiological studies in the rural areas, which Mr. Dhawan probably he does. We know that one lady who was the first person in India, he was from my alma mater, AIIMS, Delhi, Dr. Sushila Nayar. She did actually first time she found out that fluoride is real problem in central part of India. And a lot of work has been done. Then another colleague of mine from AIIMS again, Delhi, they worked out on the iodine deficiency, what we have in our water. So that, these kind of things, they all these remedial issues, they come from the health settings only. And of course, most of the times, the health authorities of the concerned hospitals or the healthcare setup, maybe district or institutions like ours, that they keep on informing and they keep in, collaborating with each other, with the local governments, including the municipalities and others. Yes, there is a system.
Right. Mr. Raman, I noticed that you were nodding because, like Dr. Singh pointed out, that you need specific studies and not just wait for outbreaks to test for the prevalence of non-infectious reasons behind disease. Now, my question to you is, do we leave everything to the government? Government एक कमेटी बनाएगी, जो कमेटी एक डिस्ट्रिक्ट में जाकर टेस्ट करेगी, फिर एक और कमेटी बैठेगी, they'll think about क्या करना है, what are the solutions? How can community be involved? What is the role of the private sector? Because there seems to be a business opportunity or a need, like Mr. Chamkur Singh said, you've got to get a private filtration at your home because X district is not going to be forever supplied with only surface water. Things could change, right? So could you tell us how does it work holistically between the government, between the private sector, between individuals to ensure that safe water is available for everyone?
So this is a very pertinent and important question. Interestingly, in a governance scenario wherein visibility becomes more important than the actual result of what you are doing, some quick responses like setting up a committee and those kinds of things becomes so as if the authorities have done something in a quick manner. Interestingly, I was director of State Health Department in the state of Chhattisgarh of the State Health Resource Center. So this is a government technical advisory unit. So there is one important example from there, and similarly another important example that I have observed in Bihar. So I can bring in these two for answering what you have asked. One is when I was the director of the Chhattisgarh State Health Resource Center, what we have initiated was the community health workers in Chhattisgarh. They are called Mitanins, and they started in all those town areas where water supply systems are contaminated with sewage water or related issues. So they did. They have given field testing kits and training was given, and they did the periodic testing and reported water quality on a regular manner. So this was something out of the public health engineering system, but within the public health or health services, the umbrella. So when this was possible, and then the outbreak is something that you can at least you can guess where that is happening, and also the public health engineering department can be advised that this is the area where you are getting most of the water quality problem, so you need to either change the infrastructure, those kinds of things. Of course, there were gaps about field testing kits because we don't have a standard in our country about the field testing kits, and also the field testing kits, the results are not necessarily always so we have new testing methods using Android phones and sensors and all that. Again, there is a problem of standards. So one important issue is that the remedial measures, we cannot actually put the evidence creation as a remedial measure. So we need to do the evidence creation and the investment in research, testing and all that infrastructure. The role of private sector that you asked is a very important question. See, we have a major gap about laboratory infrastructure across the country. The public health engineering department's laboratories are one in a district, and the number of samples, if every area is starting to send them samples, the testing is not going to happen in a specific period of time. So one of the possibility that when I was in WaterAid we have developed this idea that how our pathological laboratory chain, both in government and in private, can develop water quality testing skills also, because it's all about adapting to some because they are testing blood regularly, so it is not that they may have all the equipments. It's all about how to have a module that helps them to also look at water from a perspective of hydrological perspective and also from a water quality perspective. So how can we think of expanding the water quality testing infrastructure by way of engaging the larger available infrastructure and the technicians, the lab technicians across the country? That is one possibility. The second possibility is about the purification process. how can we embed the water safety planning, including sanitation to water sources, sanitation, pits or tanks or whatever, the distance, safe distance, how can we horizontal and vertical both, how can we ensure that, how can we look at agriculture and look at reforms for reducing the nitrate content in soil. There are many things for anthropogenic contaminations that we need to do. Similarly, I can also tell about the Pollution Control Board in Bihar. It's a great example wherein they are fighting arsenicosis in a major way by way of bringing in the health department. So they have mandated. Actually, a pollution control board is only supposed to do about regulating the water, standards, ensuring and all that. But they are also looking at the impact of the problem. So the vice chairman of Mr. Ashok Ghosh, Dr. Ashok Ghosh, who is the vice chairman of the Pollution Control Board over there, is also researching on these issues. Probably that is the reason. But it is proven that a body like a Pollution Control Board can also intervene in these issues and then mandate the public health engineering, also the health department, to work together to mitigate these issues and to help people. In Jharkhand, they have something called Jal Sahiya. It's another community worker for looking at water and water quality issues. So we can have lot of remedial issues that can be introduced from the community point of view, regulatory point of view, and also health services point of view. So the possibility is there. It's all about will, whether we are ready to do this kind of initiatives in scale or not. Yeah.
All right. Will is important. Mr. Singh, Mr. Chatkar Singh, in your mind, how important is regulation? Because, while Mr. Raman is saying that if you have the willingness, there are many arms that can make a difference in testing, in investigating, in doing the right thing. But where is contamination happening? Industrial effluents are going to the rivers. We are then treating it, and it's such a vicious cycle. Could we come up with better methods for the companies and corporate India as well? Could we have harsher rules? Pollution Control Board has its role to play. Is it being enforced well? And you also mentioned at an individual level, having a filtration system at your home. What can individuals do? What can be the effort on their part? We've heard Mr. Raman, we've heard Dr. Singh talk about, how the public health machinery works, how the water treatment and supply infrastructure works. What about other participants? What about corporate India? What about individuals? What role do they have? Mr. Chatkar Singh, the question is for you.
Actually, I think there is some disturbance actually in the net connection. So
I'll repeat the question. The question is, Mr. Singh, can you hear me?
Yes.
Yeah, so the question is that we've understood the role being played by public bodies, be it healthcare or urban infrastructure, in ensuring that testing is happening and clean water is being supplied. What is the role played by private citizens, by corporates, to ensure that pollution itself, contamination itself is reduced? And at individual level, how can awareness be increased on the measures they can take to conserve water, to keep it clean?
Sorry, still I'm not able to hear you. I think the net is not stable here.
Well, I'll try once again, Mr. Singh. The question is, what is the role that individuals and corporates have to play in this entire clean water scenario in our country?
Okay. Hello?
Yes.
Yeah. Actually, like I can give you the example of the Faridabad Smart City. So here actually, the water supply source is from the rainy wells. So basically, we are having a 16 number of rainy wells from where actually we are drawing the water, and we are through the main boosting station and the subsidiary boosting station, we are supplying to different sectors and the colonies. So here actually, I can give you the example. The most of the local people, they are often like complaining about they are not getting the water supply from the individual boosting station. So they have given the complaint to the local bodies and the municipalities, and they are saying that although the like the pump operator, they are saying they are supplying the water to the different like the sectors or the colonies, but still they are not getting the water. So here what we have done as a Faridabad smart city, we have introduced the water SCADA system. So on their complaint. So in the in the water SCADA system, we have electromagnetic like the flow meters. So at the inlet also and the outlet of at the outlet of the rainy wells, then the inlet and outlet of all the boosting stations, the main boosting station, intermediate, and the sub boosting station. So and plus we have a pressure transmitters, we have a level transmitter also. So what we are doing, we are like and it is also like integrated with the ICCC building, the integrated controlled and the command center. So from their complaint, actually what we are doing, we are like checking the water at the inlet also and the outlet also of each and every colony. So they are saying like some citizen of the ward number 1 is saying we are not getting the enough water. So now, although this project is still under execution, so we are actually now trying to provide the data actually everyday basis actually how we are like giving the water to these people. This is one. And second thing is in the Faridabad city, one of the major project is the Bhatkal Lake. So Bhatkal Lake is so this is actually the famous lake in the Delhi NCR region, and it spreads around. It is spreading around more than like the 100 acres of area. So since 2006, due to the mining activities and all the other things, now it is dry. So now what we are doing, we are trying to like rejuvenate the Bhatkal Lake also, so that the people of the Faridabad and the people of the Delhi NCR, they will have a very nice like the lakes. They can spend the quality time during the weekends and in the evening here also. So what we are doing, since as per the NGT law, we are not able to like supply the potable water to the Bhatkal Lake. So we are now constructing a 10 MLD of STP, which is based on the SBR technology with the tertiary treatment, also the filtration and all those things. And we are supplying the water which is in the range of 5 to 10 milligram per liter of the BOD. So this way actually we are like trying to like we are like accepting the complaints of the individual people regarding the proper water supply, regarding the like the rejuvenation of lakes and all those things. These so we are also having tender out 11 like the small STPs also, so that we can have the less burden on the potable water supply, because here the water supply is very limited. Only 60 or 70% of the water are getting the proper actually water supply. So we will supply the this one, the recycled water for all the non-potable application like the filling of lakes. Then we are supplying for the horticulture purposes and the other like the industrial application also. So in this way actually we can say we are like addressing the most of the people concerned, and we are trying to we are doing some sort of the water and the wastewater management, so that
availability is improved. Availability is also improved. Yeah. Right. Dr. Bansal, we've heard from Mr. Champur Singh, and he has given us examples of what municipal corporations are doing to ensure that supply is good, conservation also happens. Could you also give us your ideas on how we can improve not only the supply of safe, clean drinking water, but also our efforts needed towards conservation as well? And who will do this? Will it be the authorities? Will they only be recycling? Will individuals recycle? And if you have any view on what should be the role of corporate India in this entire scheme of clean drinking water?
Sorry, pardon, I could not get your question because again, the problem is, I think you are asking the supply of the water supply. This is through the local bodies. This is the question, or anything else was that?
Yes, sir. The question is, what are the innovative ideas for supply of water to households, and what is the role of conservation?
Okay. now the 2-3 things we have done in this matter. Like we have coordinated with the development authorities. Now that they will not approve the map. That will be approved if the person is applying the water for water preservation, water harvesting procedure is there, that is encouraged by the government. They are giving the subsidy also. This was the one thing for household person can do. Secondly, that is through SCADA meter. Now problem was that in India, the people doesn't know the value of the water. If the water supply the government is giving, somebody has opened the tap, they will not even again is block that tap. For that, the government what they have done, they have put now SCADA water meter. That will be again, it will be like I can say it will work on that newer technology, and the tap are also with newer technology. And immediately after, like we are using in dryers specifically in toilets, same thing is applicable in the smart toilets, so that wastage can be prevented. This is the one thing. Similarly, the SCADA meter is now fixed in every area wherever this under this project, smart city project, because this is again the private company is doing that, so that they are fixing the meter and that will be chargeable as per that the metering, so that in that manner both the things will be done and resources will be saved of the government. Secondly, because the person has to pay, so that they will be more aware. And third thing, for rainwater harvesting, government is facilitating, so that majority people are encouraged towards doing these things. So these are the things which we already have started adopting these things. Yeah.
Right. All right. So this SCADA facility is of course something which Mr. Timkar Singh also spoke about, and I'm sure for smart cities this is a good solution for supply of clean drinking water. I will take closing comments from all of you. Now we are coming towards the end of this session. Dr. Sarman Singh, I want to start with you. What would you like to say to the audience, especially individuals? What can they do to keep themselves safe? The government is making a great effort in ensuring piped water comes everywhere. What should individuals do to conserve water, to ensure it's clean? If the resources are limited, how can they ensure filtration on their end? What would you like to advise?
Yeah, I think this is very pertinent question, even though closing remarks, so I will try to do it in 1 minute itself. But definitely the responsibility, government, obviously they have their duty and obligation as well. But also equally, each and every one of us is also equally duty bound, and also it becomes a necessity. And everything cannot be left on the government, so everybody can contribute also. It is not that it is difficult to contribute. We can have rationalization of the water, which water safe, drinking water you can use only for drinking purposes or in the kitchen, but the remaining part of the water can be recycled most easily. So that is number one. Number two, whenever there are rains, we should, each and every one of us, we must strive very hard to harvest the water. So that is also, water level is also important, and probably not absolutely, but to greatest, I can say that least contaminated water is rainwater, if you are harvesting in your own yard. So that is also very, very important. And then obviously as such, the third thing probably you also raised and we had discussion, the hand hygiene and social hygiene. So hand hygiene and waste management is also everyone's duty. It is not only that somebody will come and he will care for your hygiene. Of course, everyone, a municipality or government or whatsoever it is there, but also it is duty for each one of us that we should not defecate in open. We should use the properly hand hygiene and various etiquettes we have. So these are the things, and then you should take care of your own hygiene. If any patient, particularly I would come little in the last about the healthcare settings also, if they are there, the duty of the healthcare setting and their managers or their directors or medical student becomes, I think, more than anybody else, because the laboratory based, which are usually the diseased samples. So these waste management of healthcare waste, what we say, biomedical waste. So that is also very important, because these waste, they can cause huge impact on our environment. Equally, the pharma companies and other drug companies, plastic ban, all these things are obviously on larger scale, but as I mentioned, individually also we can contribute significantly. Thank you.
All right. Mr. Chamkur Singh, what would you like to say in conclusion? Smart cities, we're seeing great efforts. The government is also making great efforts for piped water to every household. What is the next frontier for us to ensure that safe water is available to everyone?
Actually, I have 3 suggestions. So number 1 is the reduction in water loss. So my suggestion is, if the government is providing a very safe and the potable water to each and every household, so we should not use the the RO, because RO is basically actually we are wasting the water, because nowadays we have seen most of the condominium, they are having their own RO system also, and then the individual, like the household, the apartment owners, they are also using the RO system. So in this way we are increasing the water loss. So this is the one thing. Second one is the rainwater harvesting, like sir said, every community should have, and every household, even the plot area is around 300 or 500 square yard, they should have a rainwater harvesting system. They should either store the water and reuse for the for the gardening and all those things, or they can just percolate the water so that the groundwater table can increase. And it is recharged. And third thing is, I think every condominiums and every the society, they should have the STPs, because in every community we have a gardens, we have a very nice green areas, around the road also, both sides of the road also, and in the center, the garden is there. So we can use, there are the very various technologies are available, from where we can reduce the BOD and all those things, and we can safely use that water for the horticulture and other non-potable purposes. So in these 3 ways, actually, we can have the water and wastewater management.
Very important suggestions and doable suggestions. Dr. Bansal, what would you like to say in your closing remarks?
Again, I will say that it's a very good interactive session which was put by you, but everybody will and should think for how the water can be saved and what best we can do for saving waters and for preventing the water for decontamination, which is done by majority of us and the people or mates who are known to us. We can highlight the things, the benefits of those, and we can spread to society. These are the benefits. Majority disease can be prevented. 80% disease can be prevented. Once again, I will be saying the same thing. If you are following the things, and that is real services, not for the nation, not for the government. This is especially for you, for your family.
All right. So each one of us needs to make that effort. Thank you so much, Dr. Bansal. Last word to you, Mr. Raman. What would you give as your last message to everybody hearing? Since you have an overview from the public health system, what's the last word that you have?
Okay. So I hope I'm audible. So this issue is, about impact of water quality or safe water in the health, and that is what we were discussing. In that sense, it is very important that people are collectively doing something to understand the water quality and to address the water quality. Other suggestions came by given by my fellow panelists are very important and very relevant. So I'm getting into the water quality part of it. So water quality, one, how to periodically ensure the quality testing and to understand what kind of contaminant is causing what kind of problem to our kind of health, and then to get the governments to address them through, not only, just pressurizing the governments, but also to provide them practical solutions is something that people with technical knowledge and understanding within the community can do. So how to do that is one important thing. And the second, when we are working on the water quality, we cannot avoid water conservation, and only talk about quality and the health. So we need to, if at all the health of water is also important, or health of, the water sources are also important. So for that, how can we look at water budgeting as, what is the kind of requirement that we have to understand that, and then based on that, measured use of water. So including, the urban local bodies and all. Currently the system is that we are giving the connections, but no metering is there except in few cities and towns across India. So how can we introduce metering, and metered consumption is a kind of question that we need to look at. And finally, the government central and state governments has to look at how to empower and strengthen the urban local bodies and the rural local bodies in order to address, understand and tackle the issues of water quality, water conservation and overall water future. Thank you.
All right. Very interesting discussion and very important points raised by all our speakers on the efforts that need to be done at a local body level, at the government level, at the individual level, to ensure that not only are we getting safe water, but we're also not wasting water, saving water and recycling water. So that our goal is to not only keep ourselves healthy, but to ensure that water is available when it's required. A big thank you to all of you for joining us. Mr. Timkor Singh, Dr. Rohit Bansal, Professor Dr. Saman Singh and Mr. Dhawan, thank you all for joining us. Pleasure having you with us on this show.
Thank you so much.